Hello, my name is Dr. Douglas Ross, and I have the honor and privilege of serving as the Chief Medical Officer here at CHI St. Vincent. I also serve as the President of our Hot Springs Ministry. And I wanted to talk to you today about masks. These have become a part of our life the last several months. Prior to COVID, we would see these masks in the procedural areas, in the operating room. We would see them in our isolation areas. But now we see them everywhere. They're in every department of our hospital. And now they're in our lives outside of the hospital. They're in our restaurants. They're in our grocery stores. And while they have done a tremendous job of helping keep us safe and slowing the spread of the coronavirus, they've also created some challenges. And one of the challenges that we have heard about from our patients and our caregivers is that they create a barrier in being able to personally connect with our patients. We have a core value of compassion. Kindness and compassion are the foundation of our ministry. And it is amazing how much a simple smile or a simple facial expression without words can convey compassion. And with the mask, these smiles, these facial expressions really can't be seen by our patients. So we have to now be very, very intentional about other ways to convey kindness and compassion to our patients. And I wanted to talk to you about a couple of those this morning. The first is, and we've all heard this with our engagement with the Studer Group, the principles of ADED. Those principles continue of acknowledging yourself when you meet a patient, introducing yourself, explaining why you're there, explaining the duration of what you have to do, thanking them for choosing St. Vincent for their care. But there are some additional things that we can do to help convey compassion. The first is really creating that sacred time when you first walk into the room. We're all busy, and our tendency is when we walk in the patient's room to immediately get started on the task at hand, to immediately go to the computer. I would encourage you in that first few moments of walking into the room, go directly to the bedside and personally connect with the patient. You need to create a very sacred time in those first moments that you're in the room. If the patient has said something during their stay about their dog, talk about their dog. If they've said something about their grandchildren, bring up their grandchildren. We want that patient to know, even though we may be very busy, we want them to know that in that very moment, we are 100% engaged in the care of that patient only. Another thing that we can do, if possible, is try to sit down when you're in the room. When you're talking with the patient, sit down at an eye-to-eye level. And it really, really helps our patients connect with us, and certainly helps make it seem that we are in the room much, much longer and much more interested and engaged in what that patient has to say. And the other thing is though, even though smiles may be harder to convey because we're all wearing a mask, there are other ways that we can show compassion. The simple touch of a hand is a very, very effective way of showing kindness and compassion. The simple patting of someone's back, holding someone's hand during a challenging time, all of these things are very, very effective. So while I know that there are still smiles ongoing under the masks make it harder for those to be seen by our patients. And we need to focus on other ways to help us meet that core value, compassion. Thank you for your day. Thank you for your time, and we are blessed that each of you are a part of this ministry.